Now shifting our focus as far as the COVID picture in the country is concerned, and this is what sources are telling CNN News 18. The Health Minister is likely to visit the Delhi airport tomorrow to check how the RT-PCR management is going on at the airports. Remember the BF.7 variant, which is being seen as the cause of the surge, especially in cases in China, 16 times more infectious. BA.5 was 1:4 ratio. Deaths will not rise in India is also what we're understanding. Sources also telling CNN News 18 that 6,000 international passengers have been tested in the last 2 days. 39 of those have been tested positive. Remember, as far as the spread of the BF.7 variant is concerned, many experts believe that India might not see the kind of wave that China is seeing because of the efficacy of our vaccines and also because of herd immunity. But because cases continue to rise in China and because we don't have an official number coming in from the government there, the worry is that we could see cases increase because the restrictions have been completely taken away. Let me bring in my colleague Yash, who in fact has been tracking these developments for us. Yash, any more details that you're picking up as far as the plan of the Health Minister?
Well, in fact, Ridhima, right now the plan of the ministry and the minister is to contain this virus as much as possible in India. And in fact, it has been stated that BS7 variant is it is 16 times more infectious than the past variants we have seen in the country. But the important thing to understand right now is that deaths will not rise in India. This is what we have been given to understand. And in fact, tomorrow the health minister, the officials from the health ministry and the minister will be visiting the airport to take cognizance of the arrangements that have been made at the airport. And in fact, today also there were certain questions that were raised by certain passengers on social media that people coming in from Thailand and certain other countries, there's no test being done for them specifically, and there's no order as of now. But what we are also given to understand that this entire situation remains to be grim in neighboring countries like China, and in fact in US also we've seen large number of cases owing to this particular variant. But as of now in India, we are told and we've seen that the rise is very steep, but there is nothing much to worry about this particular variant's virus.
Right. Yes, but because usually this is the pattern that we've seen in the previous variants as well, that no two countries see a peak at the same time. So most experts saying that the next 30 days actually are going to be very crucial for India to monitor if we actually see a surge in cases. Keeping that in mind, what are the kind of precautions that we could see being added for India as well?
Well, the main, right now what the government is focusing on is containing this virus, and what the government is depending upon is that all the COVID protocols should be followed by the general public, including masking up, maintaining social distancing, and getting the precautionary dose done. Because we have seen most of the people in the country right now are vaccinated with both doses, but the third dose is where we are seeing less numbers. And in fact, the government is focusing on that thing only, and we've seen also the rise in registrations for this very precautionary dose, and now people are also stepping out, and they are also understanding this entire situation and what is happening in China and other nations right now. And the ministry and the central government and all the state government would want to ensure that there is no larger outbreak of this particular variant. And in case if there is any person who's found to be COVID positive and in genome sequencing it is found that that person belongs to is infected with that particular variant, so the ministry and the central government wants to contain that virus there only.
Okay, Yash, we leave the conversation there. So we're understanding precautions are in place. It's not a case of panic as of now. 39 people out of the 6,000 that were tested have tested positive, and their samples have been sent for genome sequencing. We'll keep tracking all these developments. For now, we're slipping into a very short break.